I'm Dr. Connor Murray, the Principal Radiologist and CEO of ChestRad Radiology. ChestRad is a private practice in Perth, Western Australia. So ChestRad was established primarily for lung cancer screening purposes, but as we've evolved, we do more and more cardiac screening and coronary CT and calcium scoring. So 30 to 40 patients a day, of whom roughly 2/3 to 3/4 would be hearts. We have recently upgraded to the Siemens Neotom Alpha CT machine. The benefits of the Alpha are multiple. From a purely business point of view, we saw the opportunity to reduce our contrast volume use. So the Alpha has exquisite contrast sensitivity intrinsic to the detectors, and we anticipated and have since shown that we can reduce our volume of contrast by about 50%. And in our part of the world, contrast is expensive, and that in itself was a large part of the business plan. Secondly, we were hopeful of reducing repeat scans, which of course may require beta blocker, extra beta blocker, and then more contrast and soak up time. And we had modest expectations that our repeats would reduce by about 25%, and we've noticed that it's probably around 50% reduction. And thirdly, obviously, from a marketing point of view, the advantages of the ultra-low radiation dose. I think it's been a holy grail for chest imaging to truly be able to provide CT at a radiation dose that's that of a chest X-ray examination or less, as well as effectively new services like being able to image coronary stents and to see through coronary calcium better than ever before. Were very much part of the plan and thankfully have come to fruition for us. With regards to the referrers' response has been quite remarkable, particularly specialists and in particular cardiologists are obviously well aware of this machine, and to be quite frank, we are getting referrals from cardiologists who work at practices that compete with us for the photon-counting machine, and that's been a surprise. It's odd, to say the least, that a small boutique practice such as ours would install such a large machine, such a large investment. But for us, it really, once we looked deeply at it, it just made total sense. The physical limitations we have, we need slick throughput, we need high quality outcomes because we're so reliant on just scanning chests and hearts, and we want to attract the best and to produce the best outcomes. So while ostensibly the upfront cost is very high compared to other CT machines, we were quietly confident that that would be more than offset by reduction in costs from consumables, as well as increase in revenue from new revenue sources. And the good thing about Siemens machines, they always do exactly what it says on the box. So if it's there in the science or it's there in the promotion from Siemens, it always does it.